discussing about anesthetics, local anesthetics and general anesthetics. Okay, so this is the classification of local anesthetics, volatile anesthetics and intravenous anesthetics. So volatile anesthetics, already we have seen ethers and hydrocarbons, halogenated hydrocarbons. And intravenous anesthetics, say barbiturates, you can barbiturates are mostly having sedative and hypnotic activity. Other than this, some of the barbiturates are having anesthetic action. Okay, anesthetic action, that is also general anesthetic action. General anesthetic action, some of the barbiturates are having epileptic, anti-epileptic action. Okay, so barbiturates are widely having various activities. Most of the barbiturates are having this sedative and hypnotic activity. There in the sedatives and hypnotics, long acting, short acting, ultra short acting barbiturates, different classification of barbiturates we have seen. In specifically, some of the barbiturates are acting as sedatives and hypnotics, and some of the barbiturates are acting as general anesthetics. All of the barbiturates, most of the barbiturates are acting as sedatives and hypnotics. Some of the barbiturates, for example, thiopental, thioamylal, hexobarbital, methoxytol. Okay, thioamylal sodium, thiopental, hexobarbital, methoxytol. These are acting as general anesthetics, and some drugs are there, specifically these phenobarbital, okay, mifebarbital. These are acting as epileptic drugs. So combination you have to see which of the following barbiturate is having an anesthetic activity. Which of the following barbiturate shows anti-epileptic activity? Okay, this kind of questions can be asked. Next opioid analgesics, ketamines, this we have already seen, and now we will move to this local anesthetics. What are local anesthetics? Already we discussed. Patient will not undergo unconsciousness. Okay, only numbness or loss of sensation will be applied to, strictly restricted to that particular part where the local anesthetic is given. Okay, so mechanism of action, three important points are there. It decreases the excitability of nerve cells without affecting the resting potential. Okay, so this particular point can be asked like local anesthetics will affect the resting potential, true or false? False. Okay, it will not affect the resting potential, and it blocks the generation and conduction of nerve impulses. The nerve impulse is blocked, generation and conduction. Okay, nerve impulse generation and conduction is blocked. It also blocks the or decreases the excitability without affecting the resting potential, and decreases the permeability of cell membrane to ions like sodium, thus preventing the sodium depolarization. Okay, so this is the mechanism of action of local anesthetics. It blocks the conduction, it decreases the excitation, it blocks the generation of the nerve impulse, and without disturbing or affecting the resting potential. Also blocks the sodium conduction, permeability of cell membrane to sodium. Okay, permeability of cell membrane to sodium, thus preventing the blocks the sodium depolarization. Okay, this is the mechanism of action of local anesthetics. Now let us see the classification of local anesthetics. Different classes are there. Okay, natural agents like cocaine. Okay, this cocaine acts as a local anesthetic, and synthetic nitrogenous compounds. Okay, synthetic nitrogenous compounds. First one is derivatives of benzoic acid, derivatives of para-amino benzoic acid. Okay, benzoic acid derivatives and para-amino benzoic acid derivatives. Then again this PABA derivatives are divided into freely soluble and poorly soluble. Freely soluble examples are procaine, amitrocaine, and poorly soluble examples are benzocaine and orthocaine. Poorly soluble, freely soluble are procaine and amitrocaine. Poorly soluble are benzocaine and orthocaine. Benzocaine and orthocaine. Next, anilide derivatives, acetanilide derivatives, lignocaine, mepivacaine, bupivacaine, prilocaine, atidocaine. So, acetanilide derivatives, if you observe, how can you identify or remember this anilide derivatives? Okay, anilide derivatives, all the drugs are having I in their first part of the name. Okay, so Cocaine is a natural agent. Next, benzoic acid derivatives, parabenzoic acid derivatives, para-aminobenzoic acid derivatives. Para-aminobenzoic acid derivatives are again divided into freely soluble, poorly soluble. Freely soluble examples, procaine and imethocane. Poorly soluble examples, benzocaine and orthocaine. And acetaldehyde derivatives, if you observe, in the first half of its name, all I will be there. Lignocaine, mepivacaine, bupivacaine, prilocaine, etidocaine. All I's in the name, first name. These are anilide derivatives or acetanilide derivatives. Quinolone derivatives you can identify easily, cincocaine and quin. Cinchona derivatives, quinoline will be there, isoquin. Dimethisoquin, quinoline derivatives. Synthetic non-nitrogenous, all these are having nitrogen in their substance, and non-nitrogenous substances are benzyl alcohol and propanediol, okay, alcohol containing drugs, benzyl alcohol and propanediol. Next, miscellaneous drugs with local action. Miscellaneous drugs are like clove oil, phenol, chlorpromazine and some antihistaminics, example diphenhydramine. These are also acting as local anesthetics. Which of the following antihistaminic drug has local action, local anesthetic action? Diphenhydramine. Okay, some of the antihistamines like diphenhydramine acts as local anesthetic drug. Okay, so this is the classification. I will explain you, I will give you a briefing again. Natural agents are cocaine, synthetic nitrogenous substances, benzoic acid derivatives, para-aminobenzoic acid derivatives. Para-aminobenzoic acid derivatives are again divided into two types, freely soluble, poorly soluble. Freely soluble examples, procaine, imethocane, poorly soluble benzocaine, orthocaine. Acetanilide derivatives, first half name is having I. Lignocaine, mepivacaine, bupivacaine, prilocaine, etidocaine. And all the last names are canes. All canes. First name is having this I. Okay. Because these are also having canes, you may get confused. That's why all anilides are having I in their first names. Quinoline derivatives, cincocaine, dimethisoquin, non-nitrogenous substances, benzyl alcohol and propanediol, miscellaneous substances, clove oil, phenol, chlorpromazine, antihistamines like diphenhydramine. This is the classification. Let us see one by one each class. Okay. So, benzoic acid derivatives examples, hexalkyne, meprilcaine, isobucaine, piperocaine and cyclomethicane. Para-aminobenzoic acid derivatives already we have seen, freely soluble and poorly soluble, procaine, imethocane, benzocaine, okay, chlorprocaine, all this, binoxynate, butacaine, tetracaine, okay. So, try to remember the benzoic acid derivatives and anilide derivatives anyhow you can identify, lidocaine, mepivacaine, prilocaine, etidocaine, bupivacaine. So, only this if you remember, rest of the derivatives are para-aminobenzoic acid derivatives. So, buta, okay, all B's, benzocaine, butamben, binoxynate, butacaine, okay, and procaine, tetracaine, pro, procaine, chlorprocaine, propoxy, all B's, buta, benz and propoxycane, tetracaine. Okay, so B containing drugs, canes, okay, and 3 carbon, procaine, tetracaine, 4, okay, procaine and chlorine derivative, chlorprocaine, okay, procaine, chlorprocaine, propoxycane, okay, all P's and tetracaine, and all B's, benzocaine, butamben, butacaine, binoxynate. All these are para-aminobenzoic acid derivatives. Rest of the drugs like hexylcaine, meprilcaine, isobucaine, piperocaine, cyclomethicane are benzoic acid derivatives. Anilide derivatives also called as 2,6 xylidins. 2,6 are xylidins, because I will show you that moiety. Because of that moiety, it is called 2,6 xylidins. They are lidocaine, lignocaine, mepivacaine, prilocaine, lidocaine or lignocaine, both are same, bupivacaine and etidocaine. Miscellaneous drugs already we have seen, dimethizoquin, dicyclonine, pramoxine, diperidone, phenacaine, debucaine, okay. These are the examples of different chemical classes and their examples.